concept of the inner sight or inner wisdom. So, attaining the sight with the help of the philosophy, attaining the knowledge with the help of the gurus is still a need of their own eyesight is still demanded and needed. So, with the help of the today's distinguished speakers, it becomes our very important day when they will pour their knowledge to celebrate our today's World Sight Days webinar. So with these words, I welcome you all to this webinar, and again, I refer back the platform to Professor Pawan Kumar Sharma ji for the further proceedings. Thank you, sir. Namaskar.
Thank you very much, sir. Thank you very much. Now I would like to request Dr. Pundareekaksha, who has supported me out of the way. Excellent, excellent, doctor. I am communicating my thanks. But before calling you, it is my sentiment that I would like to request AYUSH Sharma from Mauritius to bless the event as initial words. Dr. AYUSH Sharma. Then I would like to request my Pundareekaksha for starting the webinar. Dr. AYUSH
Thank you very much, Pawanji. And
Pranam, pranam.
इसका लोड संवरण कर नहीं पाया मैं. इतना महत्वपूर्ण टॉपिक है आज आपने जो चक्षु इंद्रिय पे लिया है, आई केयर पर जो लिया है, और मुझे लगता है कि शालाक्य से अधिक स्कोप शायद ही किसी और सब्जेक्ट का हो, क्योंकि मोस्ट ऑफ द आई डिजीजेस आर not only eye diseases, most of the diseases are like not much curable by the Western medicine. They are only manageable. And when it comes to eye, then they are really like a hands up. Patankar ji, namaskar. So I recall when my wife, Dr. Aparna Sharma, who happens to be in this webinar as well from NIA Jaipur, when there was a choice to select among Shalya, Shalakya and Kaya Chikitsa at Patola, then we went ahead with Shalakya in the year like 2002. Because we knew this holds the future. And very interestingly, I am treating a patient like out of my routine with Dr. Aparna Sharma, my wife, a patient who had pituitary adenoma, which was pressing upon the optic chiasma, and he had zero vision in both the eyes. He lost all his vision. He is from Jaipur, and 100% vision was gone. He went for a nasal removal of the some part of that pituitary adenoma. Partial removal was there, but still that did not help, and it recurred, and he again lost his complete vision. He could bounce back to 50% vision in one eye and 25% vision in the second eye with the simple like Vat Kaf Shamak Chikitsa, what we gave, simple Shaman Chikitsa, what we gave him against the pituitary adenoma. So I believe, and we all know the living example of the ex-Prime Minister's daughter from Kenya who regained her vision at Sridhariam. So really, I believe like there might not be like a better prospect when it comes to serving the mankind through Ayurveda than Shalakya is among the top rankers, and looking forward to hearing the experts, Pawanji.
Thank you, Dr. AYUSH. Thank you so much. Namaskar, Aparna ji, namaskar. Thank you very much for joining today. Now I would like to request Dr. Pundareekaksha, head of the department in Coimbatore Ayurvedic College, Department of Shalya and Shalakya. And really he has done great support this month, and I am requesting him to support like this every month. We are here to invite new talents and unknown talents, unknown for me, minimum. So thank you very much, Dr. Pundareekaksha.
Sir, thank you, sir. Thank you so much. I am so happy to see you again, sir. So I used to attend your webinars, and this time I forcefully told to my colleagues to participate and present the papers. Okay, they are very interested to participate, and along with that, students also, so many are attending. Okay, today also few students are joined. Thank you so much, sir. And I should tell thanks to Agnihotri sir and all other participants and along with the organizers. Okay. So without delay, I will start my topic. The star is, shall I share my PPT, sir?
Sure, sure.
Yes, sir.
In the meantime, I would like to request all the participants to keep their mic mute.
Okay. So all of you, World Sight Day wishes for you. Actually, it is October 13th. And is it necessary to tell, is it World Sight Day on October 13th? Because as per Ayurveda, every day is the sight day. So we have to protect daily, not only on the one particular day to celebrate. Okay. By birth itself, we got one God's gift. So vision. Okay. If you are not having the vision, is it there is no chance of to sit in front of the mobiles or computers to attend this webinars also. So we are getting the knowledge. So we are getting the knowledge only because of Indriyas. In that, all the Indriyas, very important is the eye. Okay, so we have to protect that. For that only they are telling Sarvendriyanam Nayanam Pradhan. Okay, so eyes are very important in all the Indriyas. Sarva Indriyas they told. It's not only Sarva Indriyas means not only the Jnanendriyas. Okay, so we having Ekadash Indriyas, Pancha Gnanendriya, Pancha Karmendriya, and Ubhayatmaka Manas. Okay, Manas is very important to transfer the information from eyes to brain. But if eyes are not working, it's the communication will not happen properly. So even though we having the ears, nose, and all other. Okay, so eyes are very important to receive the information and to communicate with the world. Okay, so once again, all of you welcome for the session. So today I'll give some brief about the eye care, how we can do, and some other the presenters also is there. They will elaborate some more. Just I'll give the brief idea about that, how we can do. So what is the care we can done if the problems happens, or how we can prevent the eye diseases. Okay, you know very well about what I am telling. Just it is a refresh. Okay, don't feel I'm not giving any new points. Okay, it's a refresh. And if you are not refreshed, if you are not recollecting these matters, again we may forget. Okay, so for that, just I will give the briefing about the blindness, and I will tell about the how we can prevent the eye diseases, how we can cure the eye diseases. Okay, now, so in Ayurveda they told Sarvendriyanam Nayanam Pradhanam. Okay, when we see the Chanakya Niti Shastra, they mentioned about Sarvendriyanam Nayanam Pradhanam, Sarvasya Gatrasya Shirah Pradhanam. Okay, Sarvendriyanam Nayanam Pradhanam, eyes are very important. Sarvasya Gatrasya Shirah Pradhanam, head is very important in the whole body. So body is divided into Shadangas. In that, one part is the head. It is very important in the body. So in that head, eyes are very important. Sarvasya Gatrasya Shirah Pradhanam, Sarvendriyanam Nayanam Pradhanam. Shannam Rasanam Lavanam Pradhanam. Okay, all the 6 rasas are there. In that 6 rasas, Lavanam is very important. All people they are telling, when I ask the same question in the class, so many people they are telling that Madhuram is very important. Some people they'll tell Amla is very important. But Chanakya Niti Shastra, it told that Sannam Rasanam Lavanam Pradhanam. Maybe that sodium and potassium, the exchange happens in the cells are very important. If there is no sodium potassium exchange, there is no energy generated, there is no nutrition is transformed. Maybe because of that, Lavanam is very important. They told in olden days, I think so. And Sarvam Nadinam Udakam Pradhanam. Okay, water is very important in the all the nadis. Nadi means river. Okay. So in the river, water is very important. If there is no water, even though it is a Ganga or it is even though Godavari, whatever it may be, it is not considered as a river. So water is very important in the river. Okay. Sarvam Nadinam Udakam Pradhanam. Okay. So coming to the blindness, WHO defined, okay, there is a different definitions are there for the blindness. And blindness is not a totally blind, okay, not only the total blind. If the person is inability to count the fingers in daylight from the distance of 3 meters, okay, it's not a meaning of night time, like, okay, in the daylight, if the person is not counting the finger with 3 meters or vision less than 3/60, okay, while examining the visual acuity, we may find out that less than 3/60 can be considered as a that is a vision loss. Okay, vision loss can be considered. If the low vision can be taken as 6/18. Okay, so we will see whether the person is having such type of the visual impairment. Okay, so we will notice what are the changes is he having. We have to examine thoroughly and we will go for further step. Okay, other than this, other blindness like a color blindness. Okay, you know very well about the color blindness. There is a 3 primary colors. If not able to identify, after that sub colors also, if not identified, can be considered as a color blindness. Okay, protanopia, okay, deuteranopia, like that, so many types also there in that. Night blindness, some people they're unable to identify the objects in night time. Okay, so that also one type of the blindness. And another is the snow blindness, the vision after exposed to the eyes to large amount of the ultraviolet rays can be taken as a snow blindness. Okay, so many types also there in this. And as per WHO, they told there is a 253 million people are visually impaired. 253 millions. Okay. So in the India, currently there are 4.95 million blindness persons are there. 4.95 million. And 70 million are impaired vision. Okay, this 70 million people are impaired, but it's not a blind. Okay, so they are having the different type of the visual changes like a myopia, hypermetropia, okay, astigmatism, presbyopia, like different things. Okay, so out of these 0.24 million people are blind. Childs are there. Okay, blind childs. See that if there is a child itself having that impaired vision, that life is very difficult to survive. Okay, that people are very difficult to survive throughout life. Okay, so we have to take care as early as possible once it is detected. Okay, so in this, if 84% of the visual impaired results from the chronic eye diseases, who all are having the chronic eye diseases. So not only that main cause, okay, I given the list of this as per the WHO. So other than this, other also there. Okay, we can see there is a other causes are 11%. Okay, so this all can cause the visual impairment. Once it is detected, we'll start the treatment immediately. Okay, it's very important the detection of the visual impairment also. And 81% of the visual impairment could be avoided if diagnosed and treated early. See, 81%. See how much the number of the diseases can be treated easily. Okay, main cause is the cataract. If it is cataract is treated in early stages, the vision can be prevented. Vision loss can be prevented. Okay, so that is a curable blindness. Okay, cataract comes under the curable blindness. If we are doing cataract surgery, can cure it. Okay, some if any vitamin A deficiency, some conditions are there. So many that complaints people are giving in early stage, we will start the treatment. Okay, this is the plan given by the WHO. We have to assess, identify, and provide the proper and inform them and educate very important. Okay, if any child is having that visual impairment, the teacher first should be identify and have the treatment should be informed to the parents. It's very important. Later, when there is a that vision checkup is doing in the schools, some when I go to some schools, the kids are there running away from there to check the vision. Some are very interested, some people are running away because the parents is told that don't go for any eye checkup and all. Okay, sometimes that may be because of some that people are feeling difficult to identify some diseases, maybe because of that, I think so. We don't know exact what is the reason. Okay, so first of all, the identification is very, very important. In Ayurveda, Ashtanga Hridaya, they told that Chakshu Rakshayam Sarvakala Manusher Etnataha Kartavya Jivita Yavada Icha. Okay, so we have to do it is the protection of the eye. The protection of the eye or protection of the vision is very, very important in daily life. Okay, today I protect my eyes and tomorrow onwards I will leave. Not like that. Okay, we should be protect daily. Okay, and if we are not protecting, we are not having the vision, that can be people are thinking this people is blind, is not getting proper support from the this society. Okay, so they told this is as a kudya. Okay, some areas told like a kudya. Kudya means it's not a good thing to tell. Okay, so we know very well Ushnabhitaptasi Jala Pravesha, that all the Nidanas explained in Ayurveda. So if you are doing, okay, there is Ahara Nidanas are there is a Vihara Nidanas also there, and along with this Manasika Nidanas. Okay, so people are who all are having that so much of angry. Okay, some people are having that there is a depressed. Okay, some people are internally they're not mingling with others, and they're like we can tell introvert. They're introvert, they're unable to share anything, and for each and small things they are feeling sad, and they're being going away from the society. Okay, if that people are there, that can lead to the vision impairment also. Okay, continuously watching the small objects or continuously watching the distance object, this all are the nidana. Okay, especially the kulutta taking or masha taking. Okay, amla padarthas and all the alcoholic preparations, this all are the uh, common cause for the development of the eye diseases. And along with this, there is some diseases is spreading from one person to another. Okay, sankramika janya vyadhis. So that also can cause the eye diseases. So we have to identify what is the cause for the eye diseases, and we have to prevent it. Okay, we have to prevent it with avoiding the particular nidanas. Okay, and nowadays in the present life, there is a all fast food items, there is all the junk foods they are taking, and preserved items. It's one of the common cause for the development of the diseases. So, and the sedentary life, the people are doing the different type of the preparations, so they are doing the different experiments with food. Okay, usually we should not use that some mixing items, like nowadays what happened, the biryani is they're preparing with curd. Okay, they're adding, actually there is a mamsam and dadi, mamsam and kshiram. Okay, this all should not mix, but nowadays they're mixing. Okay, good in that egg and along with milk, they're mixing and preparing some items. Okay, so these all are things are also can cause the viruddha of that vitiation of the blood and cause the visual impairment. And nowadays, okay, so this is the ratri jagarana. Okay, ratri jagarana and diva sapna. Okay, people are doing the night shift, and after that they are going for day sleep. So because of that, there is a biological clock is disturbed, and person is getting the eye diseases. So this is also one of the common cause for development of eye diseases. Okay, people are more becoming that visual impairment. And you see there is a sedentary life along with the usage of mobile. Okay, almost or around 50% of the people who all are coming with a visual impairment, I used to tell that avoid using the mobile in dim light. Okay, I used to tell that, especially after 10 o'clock, we have to avoid usage of the mobile. This is the common advice I used to tell to the people who all are coming to the OPD. Okay, why? Because in the night time they're off the light and they take the mobile and using. Okay, so with this, the bright light directly enter into the eye and cause the damage of the retina. Okay, so there is a, what happened, there is the bulk amount of the light rays is entered inside the retina. Okay, enter inside the eyeball and focus on the retina. So while concentrating, so if any person is concentrating, that time the light rays directly it will go and fall on the macula area. Okay, so the macular damage usually happens. There is ultraviolet rays and all the harmful rays is eliminated from the mobiles and laptop or that what are the electronic gadgets the person is using. This can damage the retina. Okay, should be avoided such things, especially in the dim light. Okay, and that is a excessive work nowadays. Because of the online classes and all other things, the workload is increased to the eye. Okay, it's not for the person, it's increased to the eyes also. So it is increased to the that is a damage of the retina, especially rods and cones and optic nerve. Okay, that all can cause the visual impairment. See, nowadays kids, small kids, they're getting the different type of the eye problems because of the play or in the childhood onwards they have started using of the mobiles. Okay, so I used to tell the people to don't give the mobile to the kids. Okay, for giving food, the feeding itself, they're giving the mobile and they're playing the some videos and they're telling. Okay, one way it is a good, they're getting the good knowledge. Okay, that is okay, but what about the eyes? Okay, so once it is damaged, it's very difficult to regain the vision. Okay, and some causes, okay, because of the diabetes. Okay, because of the diabetes, uncontrolled diabetes, that can cause a diabetic retinopathy or hypertension. If you are not treated properly, then it damages the retina. Okay, some systemic diseases can lead to the scleritis, some other diseases also. So we have to identify what's the cause for the particular disease and start the treatment for that. Okay, so the eye care is in the two forms. Okay, in Ayurveda they are telling main aim of the Ayurveda itself, swasthasya swastharakshanam aturasya vikara prasavanam. Okay, we have to protect the vision. Swasthasya swastharakshanam. Again, what is the swasthya? Okay, that is, you know very well. Okay, in that indriya, prasanna indriya word they use. Okay, the eye should be in the clear and it should be in the calm. Okay, it's not overloaded. Okay, ICs should not be in the overloaded. That can be considered as a swastha. Okay, swasthasya swastharakshanam aturasya vikara prasana. The disease is developed, we have to reduce. Okay, if you have to treat any disease, again it is divided into three type of the treatments. You know very well about all the things. Okay, no need to tell. So in that ahara vihara, you should be think about that. And so different type of the ahara vihara, with this we can protect our eyes, some type of eye exercises, and with the specialized eye treatments can be followed in this. Okay, to prevent the eye diseases. Okay, so what is the good, what is the bad should be identified properly. And you see here there is a hitahara upayoga eka eva purushaha vruddhikaro bhavati. Ahitahara upayogaha punaha vyadhi nimittam. Okay, so the proper food, okay, if you take, that will cause the growth and development of the human being. Okay, so that food is giving growth and development to the body, and same time it give growth and development to the vision also, to the eyes also. Okay, I also get the nourishment with the food. Okay, the improper food, okay, that leads to the development of the disease. So same thing, this principle can be applied to the eyes also. If you're taking improper food, that can lead to the eye disease. There is a nutrition deficiency diseases, so many are there. Okay, so proper diet is very, very important to prevent or to cure the eye diseases. Okay, okay, in this Baswarajya, they told one reference. Okay, it is there in the different books also, same reference. Okay, so this is a very good for eyes. Okay, like a sally. Sally means that is a the rice. Okay, that is very good. Nowadays, what happened? People are taking to prevent the diabetes or to control the glucose levels. They are avoiding the rice. If they are avoiding the rice particles, taking rice items, there is no proper nourishment reach to the eyes. Okay, eye is not get nourished with the food what we are taking. Okay, so there is a godum also very important, the wheat and the mudga. Okay, so the mudga, the green gram taking is very less. Okay, because of that, all people are taking this chana dal and this tuar dal. They're very less amount we are using this mudga, but mudga is very good for eyes. And saindavam, instead of taking that normal salt, we can use the saindavam. That's good for eyes. And go grutam, go kshira. Nowadays, it's totally adulterated, but we have to find if there is a fresh ghee milk, fresh ghee is available, we should prefer that. And there is a sita. Sita means sharkara. Okay, sita is sharkara. Okay, sharkara also very good for eyes. Okay, that sharkara means the we should give in the proper quantity, not in the excessive quantity. And kshodram, five type of the that honey are there. In that kshodra variety of the honey is very good for eyes. Okay, this uh, honey is having the proper property of yoga vaki. It will reach to the each and every cell. Okay, the each and every cell and give the nourishment. If nowadays it is adulterated, so freshly good honey can be collected and used. And the navanitam, butter also very good for eyes. Okay, butter also very good for eyes. And draksha and this pomegranate. And the draksha also, there is a ripen or this dried draksha also good. Okay, there is a, we can use ripen, there is a, what we can tell fresh grapes. In this, if it is in the sour taste, amla rasa is there, should be avoided. It's very, very important. Okay, the in Ayurveda they told draksha can be used. Okay, we can, it is preventing the eye diseases, like that. We should not to tell to all the people to take the all the this sour type of the grape. Should tell that it is a sweet variety of the grape is good for eyes. And there is amla is very good. It is having that chakshusha pravati. And patola, okay, because it, even though it is a tiktarasa dravya, in the tiktarasa, patola is the good. And estimadu and taking of the carrot, okay, is also good. Okay, nowadays they are telling there is a, as per the modern system, carrot is very good. Okay. And as per Yoga Ratnakara, okay, as per Yoga Ratnakara, he used there is a Panchashaka is very good for eyes. Okay, Sarvam Shakam Achakshushyam, Chakshushyam Shaka Panchakam. Okay, only 5 varieties of the leafy vegetables are good for eyes. Okay, remaining all are Achakshushyam. Okay, Sarvam Shakam Achakshushyam, Chakshushyam Shaka Panchakam. Sugandhi Vatsu Matsyakshi Meghanada Punarnava. Okay, the Jivanti and Chakravarti, there is a Kinopodium album. And this Matsyakshi, you know very well, this is the Artel and the Cecilis, easily it's available. Okay, Punarnava also easily available, and Meghanad also, it's very common. Okay, Amaranthus varieties. Okay, it's all very good for eyes. Other than this 5, remaining all Achakshushyam. Okay, so sometimes people may ask, okay, there is a Moringa is there. Okay, there is a Sigru palava, Sigru leaf. Shall you use for eyes? Yes, Siguru also we can use, but not that much of effective. Okay, not that much of effective than this 5. Okay, Agasti, that leaf also we can use. Okay, Agastya leaf also we can use. Okay, but best are this 5 only. In the Punarnava, the Sweta Punarnava is the very best than other types. And proper intake. In Ashtanga Sangraha Uttarasthana, they told that drink sufficient quantity of water after meals to protect the eyesight. Okay, so very, very important. So after having food, you should take the good quantity of the water. Okay, it's not too much of quantity. There is one reference is there. Ajirne Beshajam Vari, Jirne Vari Balapradam. Bojane Amrutam Vari, Bojanante Vishapradam. Okay, the water intake, Ajirne Beshajam Vari. If you take water in Ajirna condition, it works like a Beshajam, okay, like a medicine. Ajirne Beshajam Vari. Jirne Vari Balapradam. After digested the food, if you take the water, okay, that is Jirne, okay, Ajirne Beshajam Vari, Jirne Vari Balapradam. It gives the nourishment. Okay, it gives the nourishment to the person. Okay. Bojane Amrutam Vari, Bojanante Vishapradam. Bojane Amrutam Vari. During having the food, in between, we should take the water. And Bojanante Vishapradam. Okay. At the end, if you take the water, it works like a poison. Okay. But when you see in Ashtanga Sangraha, okay, after meals, okay, means it is this we can take like after digestion of the food. Okay, after digestion of the food, we'll take the water because Bojane Amrutam Vari, Bojanante Vishapradam, Ajirne Beshajam Vari, Jirne Vari Balapradam. After digestion of the food, if you take the proper quantity of the food, it gives the nourishment. Okay, we'll get that meaning in this sloka. Not immediately after having food. Okay, head bath. Head bath is very common. Okay, especially in the Kerala, the people they'll do the daily head bath. Okay, but daily head bath is good, but hot water bath over head is harmful to the eyes. You should not pour the hot water on the body. Okay, there is one reference is there. There is a Urdhva Kaya, we use the cold water, Adho Kaya, we use the hot water. Okay, whereas cold water bath over head is good for eyes. Okay, this in the Susruta Chikitsa Sthanam, they told cold water we have to pour on the head. Okay, it's very, very important. So we should advise to the people, if you all are coming, who all are very interested to prevent the eye diseases, they should avoid using the hot water pouring on the head. Okay, can use cold water, means like a what we can like body temperature water can be used. Okay, and if the diseases are there, eye diseases in Yoga Ratnakara, that was Snana is Vajjam. Okay, we should avoid during the eye diseases. Okay, bath is avoided during the eye diseases. Okay, and eye wash. Okay, the amlaki decoction is very good, or cold water for the eye wash. Okay, and Triphala decoction also you can use in the for Sheka purpose. It's mentioned in Gadanikraha. And face pack in the Susruta Chikitsa, it is mentioned that regular herbal face pack also improve the eyesight. And you know Saviranjana using that is cure the eye diseases and prevent the eye diseases. And okay, Padatra Dharanam, okay, using the chappals. Okay, in the Susruta Chikitsa, they told that we have to wear the chappals when we have to wear. Okay, Paduka Dharanam Kuryat, Purvam Bojanataha Haram. You see here how beautifully Susruta told. We use the chappals every time. Okay, nowadays all the people are using. Okay, chappals are they are using continuously. But what Susruta told, just please listen, all of you carefully. Susruta told that Paduka Dharanam Kuryat Purvam Bojanataha Param. Okay, before you can use. Okay, after having the food also you can use, not during having the food. It's very, very important. It is mentioned in the Susruta. Okay, I don't know what is the reason for this. but Sushruta told maybe in olden days they are sitting at down. By that time, if you are using chappals, it may that all the dust or bacteria, organisms, they may reach to the food. That may be reason. I think so. Exactly, I don't know. That okay. So different causes also may be there. So for that, while having the food, you should avoid wearing the chappals. Okay, it is from Sushruta Chikitsasthana. And Bhava Prakash also told same thing. And wearing the umbrella, okay. So this can it is protecting head from the sunlight, and same time it protect the uh, from the rain also. Okay, if there is too much of the falling of the rain, also not good on the head. Okay, and Varnam Chakshusham. Okay, this umbrella using is Chakshusham. And there is a Shirastarana Dharanam also. It is good for the eyes. And nowadays you can tell the people if you who are suffering with eye disease, tell them to use the cap. Okay, so with this, the light directly, the sunlight will not be directly go inside the eyes. Okay, and Padabhyanga, Pada Prakshalana, both are also good for eyes. Okay, there is a Tilataila we have to use for the that Padabhyanga. And here, okay, in this picture you see there is a two hands we are using for the Abhyanga, like usually therapists they are doing. But in the classics they told that for right foot, okay, right sole, we have to use the left hand. Okay, for left sole we use the right hand. Okay, there is a what we can tell, there is a north pole and south pole. Okay, so maybe because of that they told, I think so. Actually I'm not that much of a expert in that. Maybe I used to think like that. Okay, north pole or south pole. Okay, so for that for right we use the left hand, for left we use the right hand. And there is a pada prakshalana. Okay, for pada prakshalana, shall you use hot water or cold water? We have to use the hot water only. Okay, why? Because adakayam we use the hot water. All the people they'll tell that cold water we can put the legs and we can sit feel comfortable, like, but not like that. In Ayurveda they told that for adakayam we use the hot water, for urdhvakayam sitala jala we have to use. So pada prakshalana, and for keeping the leg we use the cold water only. Sorry. Okay, next. Okay, if who all are working with the computer, these people they should be follow this technique, 20-20-20 technique. Okay, every 20 okay 20 minutes we should be relaxed. Okay, we should see the 20 feet any object or greenery is very good. Okay, we should see for 20 seconds. So this is a 20-20-20 rule. Okay, if you follow this, means it is nothing but there is a break, there is a discontinuity with a continuous exposure. Okay, means no need to put the stopwatch and every 20 seconds immediately you should be come back. Not like that. You can see more than that also. Okay, minimum they told 20 seconds. Okay, so we'll give the break while doing the work. Okay, you should not be continuously focused anywhere. This macula can be protected. And I have to tell one Netra Panchamrutam. This Netra Panchamurta is from the Chaducharya. Okay, there is one book is there, Chaducharya. In that they mentioned about the Netra Panchamrutam. In that first point, there are 5 type of the techniques is very important to protect the eyes. So this we have to follow these 5 techniques. The first technique is Vakta Puritayo Varino. Okay, we'll keep water in the mouth, and Nayanayo Prakshalanam Tribihi Prutak. Okay, so we'll keep the water in the mouth, and we take some water in the hand and we splash on the eyes. Okay, 3 times we have to splash. Okay, I saw same reference in another book. They told that okay, 3 sapta. Okay, 3 sapta means 21 times we have to splash. That reference also is there. Okay, so we have to keep water in the mouth. I used to practice this technique. Okay, So this technique is very important to we will get the one type of relaxation. Okay, who all are suffering with eye strain, we can follow this technique. Okay, I think, but we'll take one glass of water in the mouth, and we will bend forward and take the one mug of water, keep water in the hand and splash on the eyes, on the both eyes. Okay, after that, okay, after completed this session, all of you try once this technique. You feel how much you are relaxed. Okay, all the eye strain is cleared with this technique. Okay, just to follow and tell to your patients also and your relatives also. And one more thing, we should not splash water with opened eyes. Okay, so in the closed eyes only we have to splash it. And very important thing, we should be avoided sadhumansha. Okay, smoke exposure. Okay, this smoke exposure can cause the nasal diseases. Same time, should be avoided in eye diseases also. If you exposed to the smoke, okay, or sadhumansha, duma, they told smoke, and some people they told there is a dhumra, is the smoke, duma is a dust like. Okay, but duma means hair smoke. Okay, savatansha. Okay, excessive air. Okay, that will increase the vata and cause the vata vikaras, and kapha also increase with it. And ruksha, ushna adhikam tata. Okay, excessive dry things should be avoided, and too much of heat exposure also avoided. Katuka amla vyavayancha. Okay, katurasa padarthas, amla padarthas, and sexual intercourse also should be avoided who all are suffering with eye diseases. It's very, very important to control the eye diseases. With this, vata is controlled, other doshas also will be in the proper control level. Okay, it's from the Harita Samhita. And Nisijagarana should be avoided. Okay, who all are having this night shifting, I'm not telling you people to change the job, but maximum try to change the shift. Okay, at least some gap should be there, not a continuous night shift. And Jalavagaha. Okay, so continuously the tub bath, this all things should be avoided excessively. And Suryavalokana. Okay, so continuously watching the sunlight is avoided. Shukshmekshana, avoid observing the small objects. And Danta Pragarshana. Okay, so excessive the brushing, that also should be avoided for eye diseases. Okay, and second Netra Panchamrutam is Dantanam tu Vishodanam tu Satatam Vama Adasya Upari. Okay, so what no, in this they told that we have to do the breast from right to left. Okay, some people they are telling you left to right, but there is a Dantanam tu Vishodanam tu Satatam Vama. Okay, Vamaha means to go to left. Okay, Vama means left. And Adasya Upari. First we will do the lower teeth we have to brush, later we go for the upper row of the teeth have to brush. Okay, so upper jaw you should do second. First is the lower jaw. Okay, so from right to left, and along with next step is the first we will do right to left in the lower jaw, then go into the upper jaw. So this is the second Netra Panchamurtam. And third one is the Karatala Prachana. Okay, there is a Karatala Prachana means there is a finger fraction. Okay, that should be friction should be developed. Okay, on the hand. Okay, in the center of the palm we have to rub. After that, finger should be friction and apply to the eyes. Okay, this is also good for eyes. So, and same I will tell one palming technique. It is mentioned in the Gadanigraha. In this, especially they told that after taking food, briskly rub the two palms with one another and keep it over the closed eyes. Okay, it's very good for eyes. Some people they are using the rose petal. Okay, this is also one reference is there. Okay, rose petals placing on the eyes. Okay, Netra Bandanam you can done with this. Okay, this is also very good. Next, fourth one is the Bhuktavante Matitam is rubbing. Okay. Matitartaha pana salilam. Okay. There is a two meanings. Okay. One people he told that we have to drink the water after having food, like, and another meaning is that we after washing our hands, immediately the water is there in the hands. We have to rub on the eyelids and surrounding the eye area. So with this, there is a minute particles of food which is present in the Rekha Purana. Okay, that is to the, it is, if you are applied on the eyelids, it's directly it is absorbed from the eyelid, because eyelid skin is very thin. So what are the minute particles are there in that all the finger print? Okay, so what are things are there in that will be, while applying, it is absorbed from the skin. And the fifth one is the Chandrakshanam. Okay, there is a Purna Chandrakshanam. You have to see the full moon. Okay, that is also improve the eyesight. So these all are the 5 types of the protection measures explained in the Characharya textbook. Okay, so first thing, you have to keep water in the mouth and splash the water and the eyelids. Okay, and second thing, you have to rub the fingers and apply that water on the eyes. And the Dantagarshanam, it is explained. The Dantagarshanam, especially we have to do from right to left. Okay, Vamataha. And next is the first we have to press to lower teeth, lower jaw, and go for the upper jaw and Chandrakshanam. And one reference is there for the this eye exercises. Patanga Vikshanam. Okay, they told that. Okay, Patanga Vikshanam. Okay, this is one simple exercise is explained in it's not Ayurveda book. One book I saw this reference. Okay, if you are in olden days, they are doing this Patanga, this like a kite. Okay, that with this they put in the sky. Okay, in the sky there is a there is empty space. In that, this kite is moving. That time what happened? The ice is moving. Okay, right side, left side, upside, down side, and okay, all the oblique that movements is happened. So proper eye exercise can be happened. So that is one technique is followed in olden days. Okay. Tripla Prayoga, you know very well. No need to tell in detail about this, because next other 2 presenters, they will tell some more very important information that maybe it may be delayed. So I will. Okay. So Kapha diseases you should take with honey, and Pitta diseases with ghee, and Vata disease you should take with oil. And Kriya Kalpas should be used to preventing eye disease also. And this is the track for diabetic retinopathy. We'll take the medicines properly and maintain the weight and proper exercises and controlling the ABC, HbA1c and blood pressure and cholesterol, and kick the smoking habits and alcohol. It can be prevent the diabetic retinopathy. Proper exercise is very important. Stress should be controlled, especially in diabetic retinopathy. The oxygen supply is reduced. Okay, there is a hypoxia is the main cause for the diabetic retinopathy. So to maintain the oxygen levels, you can do the pranayama. If you do pranayama properly, oxygen reaches to the retina and retina get nourished. Diabetic retinopathy can be delayed. And finally, there is a acupressure points. Okay, you see in this picture, there is a second and third finger having the eyes. Okay, you see in the picture. I think I will zoom it and you can see. Okay, you see, this is the areas for the acupressure. So if you are pressing this with the minimum pressures, we can protect our eyes. Okay, thank you so much. And if you're having any queries, I am ready to give answers.
Thank you very much, Dr. Pundareekaksha.
Thank you, sir. Thank you so much.
Thank you. Very nice presentation, very inspiring presentation.
Thank you, sir.
Agnihotri, sir.
Thank you. Thank you, Dr. Pamshamaji. Great thanks to Dr. Pundareekaksha Rao Sahab. Really, it's excellent. Today, I got the exact meaning of excellent. What does excellent mean?
Thank you,
Starting
sir.
and up to 75%, I found that it is our subject you are touching. It is completely confined to the Swasthavat department and Swasthavat subject, confining to Ahar and the maintenance of whole body, which includes the eye also. Wonderfully, because we know Netra Hitkari Upay, we used to teach the Netra Hitkari Upay in that Ashchotan, Tarpan, Netravindu, etc. These are all maintained for that. So you maintain very, very vividly, and really, if a person is so aware, definitely he'll be keeping his eyes not only to his lifetime, but will also serve to the next generation by donating the eye itself, as it is a great derive nowadays. And Geedhain Dashti Apar, your regime, if anybody is going to follow, may develop the drashti of the Giddh itself. So many things are there in practice. Paduka Dharan, Shiro Western, and along with this 20-20-20. It is a wonderful program. It is not only 2020 program, rather 2022 program. And apart from that, viewing of a flying kite, it's wonderful. It itself will give you the whole of the compact effect of Tratak. Madhya Tatak, Bam Tatak, Dakshin Tatak, Urd Tatak, Adho Tatak. It will complete because the fly is, flying in the sky towards every direction. Of course, the direction to which the air is blowing, but still it's a very practical work. But we should be careful that, again, we also say that in case of this frozen shoulder and Avubahuk, the flying itself is a great phenomenon as a virtue to make this exercise of our upper arm. So thank you so much. You touched really great sector. Thank you so much. Over to Dr. Pawan Sharma ji.
Thank you, sir. Thank you, sir.
Sharma ji.
Now I would like to request Dr. Gangadhar M. Timmapur, Professor, Department of Shalakya Tantra, BLD EAS, AVS Ayurveda Mahavidyalaya, Hospital and Research Center, Vijaypura. Welcome, Doctor. Welcome.
Thank you for your welcome speech. So not taking much time, I want to.
No, you can. Platform is yours. You
Yeah,
can.
Sure. Actually, 80% of the topic was told by already Professor Pundareekaksha Rao sir. So as a duty, just I want to present myself. So is it visible, sir? Screen?
Yes.
Yeah. So I welcome all of you, Dr. Professor Vishnu Sharma sir, Professor Vineet Agnihotri sir, and Dr. Pawan Sharma sir, and Pundareekaksha Rao sir, and one more speaker, Dr. Ashish Padke sir. So without not much wasting the time, so I want to start with Ayush for best eye care. Okay, so myself, Dr. Gangadhar, Professor and Head Department of Shalakya Tantra from BLD Associations, AVS Ayurveda Mahavidyalaya Hospital and Research Center, Vijaypur, Karnataka. So before starting with this, I want to wish you all a happy World Sight Day 2022. So actually it was on 13th of October, that is on yesterday. So this year's theme was Love Your Eyes. The theme of World Sight Day 2022 was Love Your Eyes. So just to brief this, how this World Sight Day started. Okay, so it was the Chicago-based Lions Club International, okay, who observed this World Sight Day first. Okay, so they have started this day with a Sight First campaign, okay, in the year 2000. Okay, and the International Agency for Prevention of Blindness, that is IAPB, which was founded in the year 1975 in United Kingdom. This was taking this day further. Okay, and on February 18th, 1999, the IAPB joins hands with WHO to launch the one program called as Vision 2020. Okay, so that is the theme of that Vision 2020 was the right to sight. Okay, So World Sight Day is a part of that initiative earlier. Okay? And the first World Sight Day event was having the theme, the right to sight. Okay, so that was in the year 2005. And this was followed by a low vision theme in 2006, and vision in children in 2007, and fighting vision impairment in life, that is in 2008. So further yearly they were changing the themes. Okay, so this year theme was love your eyes. Okay. So as told, the aim of World Sight Day and the theme of this year is love your eyes. So encourage every individual to take a proper care of their eyes to prepare. Okay. Sorry. So since most people spend a lot of time staring into their smartphones or any electronic gadgets, as Sir told, Pundareekaksha Sir told, we advise them to follow the 20-20-20 rule, taking breaks, okay, in between their busy schedule. So by doing this, we can avoid the eye strain and the common headache, what we see in mainly the software engineers. Okay. So by this, especially the children, okay, who spend at least 2 hours outside every day. Okay. So they use sunglasses, eat a healthy diet, quit smoking, and we should advise them to exercise daily. Okay. So nowadays, what happening? So due to COVID-19 pandemic, everyone were forced to use the gadgets or the smartphones or the laptops or the computers, okay, for online classes or work from home and all this. So because of this, there is a high incidence of getting dry eyes, okay, dry eyes or what we call the shushkakshipaka, okay. So majority of children also suffering from this condition, okay. Again, as I told, so this is from a COVID-19 pandemic effect. Okay, so that is from work from home or online classes. Okay, so usually in our childhood time, what we used to do is we spend lot of time outside the home. So hardly we spend for sleep and for having food and lunch in the home, and rest of the time we spend outside playing and all chit chatting with friends and all. But nowadays, now in this year or in this era, it is totally opposite. Our children or our kids were not supposed to go outside for playing. So they used to sit in one corner of home and they used to play in the mobile. So we forced them to go outside and play. So like this situation was that. So earlier days, what happens? Our parents were scolding us, come home, sit and study. But this is totally opposite, okay, nowadays. So that is all. It's go on. It's a revolution. So we can't do much on that. So to start with, as all of you know, Sarvendriyanam Nayanam Pradhanam. Okay, the right to see is one of the basic right of human being. Okay, and it is told that somewhat 80% of knowledge we gain is through the vision. So rather than ears, nose, and other sense organs, 80% of knowledge we gain is through the vision, that is from our eyes. So only it is told that Sarvendriyanam Nayanam Pradhanam. So these quotations already sir has discussed. I didn't want to repeat again. So coming to why Ayurvedic eye treatment is necessary for today's digital life. Okay, so today's stress lifestyle has given rise to many conditions, terrible conditions. Okay, so some of which are responsible for even the vision loss, or even it leads to blind also. The person may go blind. Okay, so among such conditions are the diabetic retinopathy, the macular degeneration, the glaucoma or adimantha, what we call, the retinitis pigmentosa, and many other conditions which are increasing day by day. So in our day-to-day OPD, so what we commonly found the eye disorders, okay, which we can easily examine through a common torchlight. Okay, so if you take our eyelids, we commonly come across all these conditions like the chalagion, okay, or the hordeolum, external or internal, or the ptosis, okay, vatata vatma, or the blepharitis, crimigranthi, the stye, anjananamika, or some of the sebaceous cyst, and the entropion or ectropion, okay, or some of the allergic edemas, and the metarosis, okay, the falling of eyelash, and the tracheasis, what we call the misdirected eyelash, okay. So these are all common conditions which we found in our day-to-day OPDs. And coming to cornea, so commonly we come across the cases like keratitis, okay, the inflammation of cornea, or the corneal ulcers, okay, the Savarna Shukla, okay, and the keratoconus or the keratoglobus, and some of the inflammatory conditions of the cornea, and along with that, the corneal edema. And if you take the sclera as a structure, we come across with the patients of scleritis or the staphyloma, anterior staphyloma, and some with the blue sclera. And as all of you know, the lens, okay. So this is the avoidable blindness, what we came across in our day-to-day life, the cataract, okay. So what we call the opacity of lens. So majority of persons or patients will go blind, or they were not aware that they were having a cataract, and they neglect, and it becomes mature, hyper mature, and it affects the person's optic nerve. So if once it gets affected the optic nerve, by cataract surgery also the vision can't be regained, okay. So proper education about the cataract surgery should be needed or provided. And coming to the major part of this Shalakya, that is the refractive errors, okay. So majority of people will have the myopia, hypermetropia, and astigmatism, okay. So commonly the school going children will be having this myopia, so only we call that condition as the school myopia, okay. So only once in a 6 month or once in a year we should visit nearby schools, and we should check their normal vision, okay. So what happens if the children is having low vision in both the eyes, then he can able to tell that I am having a blurred vision. So in some conditions what happen, one eye is normal and the other eye is low vision, having low vision. So in that type of children, we can't able to or they can't able to tell that they're having a low vision, okay, because one eye is normal. So once they close their normal eye, and if they view through that low vision eye, then only they will able to get that he's having a vision problem. So to avoid this condition, we need to go to schools and have a regular eye checkups, mainly in the primary and the kids, okay, primary or pre-primary children's. Coming to management of all the common conditions, we have a Kriya Kalpa, okay, Kriya Kalpa therapeutics, all of you know, aware of that. So Paschatana, okay, so eye drops, what we call, okay, so it can be done commonly with a Jivantyadigrita or Ashwagandha or commonly Trifalagrita. So this can be done, and again based on predominance we can select the drugs or the yogas, okay. And Seka, again a pouring of thin stream of liquid on closed eyes, okay. So it can be done with a Trifala Kashaya or ST Kashaya, or a simple Kshira Saindava, okay, Kshira Saindava Seka. So it will again the patient feel comfortable, and we can manage some of the conditions by doing only Seka, okay. And coming to Anjana, so commonly used were Savira Anjana, then Chandana Anjana, and Narikela Anjana, commonly used in the Arma or the pterygium condition, okay, the extra growth present in the palpebral aperture. And Tarpana, as all of you know, so it is like popular, Tarpana is much popular. If Shalakya word comes, then the person will tell Tarpana. So like that popular word it is. It can be done with Jivantyadigrita, Patoladigrita, Trifalagrita, and Ashwagandhagrita. And Pindi, commonly done with Guduchi or Trifala and Kumarikalka. And Bidalaka or Vidalaka can be done with a paste of Manjista or a Trifala Churna. Okay. And a Netra Abhyanga. Okay, so this can be done with either Jivantyadigrita or Shatadavtagrita. A mild massage over the eyelids can be done. So these are some of the common medicines used for eye disorders. As I told, Trifala Churna, Yashtimadu Churna, Ashwagandha, Manjistadi Churna, Haridra, Lodra, Shatavari, and some of the common gritas, as all of you know. And this is as the Sir told 20-20-20 rule for mainly for the software engineers. Okay. So in between gap of every 20 minutes, take a 20-second break and look at a distance of 20 feet. Okay. So this will give eye exercise. Okay. In other way, we tell that this is one type of eye exercise. So along with that, we advise patients for palming. So this is a process of palming, rubbing the hand. So once the heat is generated, apply to the closed eyelids. And this is a sunning. So it helps better if we use the bars. Okay. This is a rolling exercise. Advise the patient to roll eyes in clockwise and anti-clockwise direction. And some of the modalities for promotion of ocular health and prevention of eye diseases, as Sir told in detail about the Samanya Nidanas. So all it includes this only: avoidance of exposure to water immediately after getting heated from outside, or exposure to sun or heat or fire. Then avoiding practices of watching very far objects, in circumventing practices of observing very minute object, sukshma nirikshana, escaping untimely sleeping habits, and avoidance of indulging in anger, sorrow, fear, and exertion. Then suppression of natural urges like controlling of tears should not be followed. So dinacharya, I won't want to repeat it, as Sir told in very, very detail. Okay? So these are also some of the dinacharya parts. So as Sir told, Ushnambu na adha kayasya parisheko balavaha taine uttamangasya balat kesha chakshusha. Okay. So below the neck or below the griva, we used to use Ushna Jala for bath, and for Shiras, the Shita Jala is advised. Okay. So it is Chakshusha. Okay. So it is stored in Astanga. Okay. These are some of the Patya and Patya. So again, as I told, Sir has already told in detail, so I don't want to repeat. So in this, Patya along with Apatya is also I have collected. So if you take a Shuka Dhanya, then Lohitaka Shali, a red variety of rice is good for eyes. Then Shastika Shali and the Yava barley is good for eyes. Okay. Then if you take a Shimbi Dhanya, Mudga, the green gram is good. And in Mamsa, the flesh of birds, tortoise flesh, and the peacock's flesh is good. And Shaka, as Sir told, Jivanti, Karavellaka, then aloe vera or unripe banana or reddish pointed gourd can be used, or it acts as a patya. And one more in relation with the dugda. Okay, so the milk obtained in evening time, okay, a fresh butter obtained from churning of milk is good for eyes rather than the milk obtained in morning time. Okay, so this reference is there. So always prefer the milk which is obtained in evening time. So that is stored for patya for eyes. Okay. Then coming to oils, Tilataila is good, and rasa, as Sir told, shita or sita sugar is good for eyes. Then Saindava Lavana is good. And food habits, okay, light and easy digestible quantity of food is good for eyes. Then timely and night sound sleep is good. Then some of the liquid drinks like Peya and Vilepi are good. And Mano Nivritti, that is the self-discipline. So that is good for eyes, okay, rather than getting Krodha and Shoka. So with this, I want to thank all of you. So as I told in starting only, so much of the points were discussed by Professor Pundareekaksha Rao sir. So just it's a repetition in other way. So with this, I conclude my presentation, and thank you for giving me an opportunity to present myself in this International Interdisciplinary Institute for Research, Education and Skills, AYUSH SAMRIDDHI. So this is, I think, a 467th lecture of series, okay, and our international conference series. Topic was AYUSH for Best Eye Care. Okay. So once again, I want to thank Professor Vishnu Sharma sir, who has given a welcome blessings. Professor Vineet Agnihotri sir, Professor Pawan Sharma sir, the convener and the host, and the sir who has invited me for this presentation. Thank you very much, sir. And I would also like to thank Dr. Pundareekaksha Rao sir, Professor and Head, Ayurvedic Medical College, Coimbatore, and other co-speaker, Ashish Padke sir, Chief Ayurveda and Yoga Consultant, Ayurvision Center for Ayurveda and Panchakarma Therapy, Navi Mumbai. So thank you, sir, once again.
Thank you.
Pawan Sharma, sir, thank you for giving me this opportunity. Thank you once again.
Thank you very much. Thank you very much, doctor. And please do join every day whenever you have time. Please do join.
Sure, sir, sure.
So now I would like to request Dr. Ashish Padkeji from Ayurveda, Navi Mumbai. Welcome, sir. Welcome.
Yeah. Namaste. Actually, I was checking patient just now. I have kept one person inside Panchakarma room, and in between I will be speaking. So, am I audible first, because I am not able to listen to your voice that clearly? Am I audible? No, right?
Yes.
Thank you. So, first of all, let me thank organizers and Dr. Patinkar sir for getting me introduced to this particular August audience. Let me introduce properly, because I have been, introduced as clinical hypnotherapist as the main. Well, I have done my MD in Ayurveda, that token in Draveguna, not in Shalakya. But Shalakya being my, and that token Netra being my special area of interest, I worked in Netra in Maharashtra for a quite long time. Then I was teaching in college for around 10 to 12 years, where I, taught in Draveguna as a head of the department, associate professor, and also I was given additional charge of teaching Netra. So this is a brief. I have also been working in the field of Ayurvedic ophthalmology, apart from the other sections of Ayurveda. And I have worked as an Ayurvedic eye consultant in one of the eye hospital in Mumbai for around 10 years. And there we used to have such a integrative fashion, so that allopathic ophthalmologists, when they feel that this particular patient will not be able to get any betterment with so-called allopathic medicine or modern ophthalmology, then they used to refer it to our OPD, and then there we used to start with our Ayurvedic way, and then vice versa, I used to refer them back, and we both used to cross-check, and then we come to conclusion what kind of changes has been taken. The very first patient of that particular OPD was myself, because I was having glasses then. I had spherocylindrical number, both components, cylinder as well as spherical, and that too again, one eye, both eyes like, myopia, and odd axis, not the 90 or 180 degree, but odd axis. And one of our senior honorary over there, who happens to be head of the department at LTMG Medical College, that is Sion Hospital, we usually call in Mumbai. So he, Dr. Jogrekar sir, so he said, Fadke, don't you have anything from your Ayurvedic side? Why means you used to use only glasses? And I said, yes, I need to actually start something from my Ayurvedic compendia. And that triggered actually, and that started the journey way back. Okay, and then after around say 6 to 7 months later, I again started getting severe headache. That time I used to do refraction with them. Almost around 100, 150 patients we used to see every day, every OPD. The morning OPD we used to see that much of patients. And even in OT we used to have a list of around 30, 35 cases, major as well as minor surgeries. So after that 7 months or so, I again started getting headache. So I was wondering whether my number is really increased now or what. And Dr. Jogrekar sir, then Dr. Vaidya, who happens to be HOD at JJ Hospital, everybody came and they used to see, they used to do retinoscopy, they used to do PMT, and then ek dusre se baat karte the. And I was really screwed up. What is happening? Like, why they are not sharing? And then lastly, Dr. Roy Chaudhary, Mrs. Roy Chaudhary, who happens to be then superintendent of Bachubhai Eye Hospital, Parel, very famous hospital of ophthalmology in Mumbai. She said, Dr. Fadke, what are you doing actually? Are you taking something? I said, yes, ma'am, I'm taking our own medicines. And she said, I'm really happy to say that you don't have now number. And I said, what? Yes, absolutely. You don't require to use number because you were using number in between. Headache is coming up, and you just leave your glasses and let's see and let's check the vision. And we checked it on a Snell's chart. It was 6665 rather. So I said, okay, fine. And then I stopped using my glasses, because those who know me since college days, they remember that I used to always with glass and that thread. Those days there was a fashion of using glass with thread. So then I stopped using glass. Now I'm 56 to be very specific. And I'm really happy to share with all of you that even I am not using my presbyopic number also. So while reading, even N5, N4, I don't require to use glasses. Now the question comes, what we have used. And in the meanwhile, when I was in search of, looking out for what exactly we can do, many people told me that, yes, we should start with many upakram like Tarpan and all that. But we started, at least I started with the simple things. Sir Pundareekaksha sir has also mentioned about it in his presentation, because in between I was able to see presentation because of patients. But Triphala is one of the wonder drug in Ayurveda, right? Triphala Churna, many people, they suggest Kwatha or decoction, as he also mentioned, but I would specifically suggest that Triphala Hima, that 1 spoonful of Triphala in a glass full of water, potable water, clean water, drinking water, you just put it in that Triphala churna in that water, keep it for overnight with lid up, and then next day you can strain it with muslin cloth, double or triple muslin cloth. Make sure that not a single particulate matter is there within that particular solute. And with that you take eye wash. If you do that, that is also very, very useful. Only thing is, when we are suggesting this to patient, we must suggest that that liquid has to be completely devoid of any foreign body material. Otherwise, that small particle will go inside the fornices and the eye, and it can create havoc. Actually, it can make the eye red. And if patient goes to allopath or ophthalmologist, modern ophthalmologist, conventional ophthalmologist, then they will start shouting, what you have done, you should not put anything inside eye, and blah, blah, blah. So that part we need to keep in mind. Other thing which I remember that what we have used and now also using, I'm sure most of you must be aware of it, but I'm sharing because I have taken it on myself. So I'm just sharing with all of you, and that is Saptamrut Loh. So Saptamrut Loh is one of the, again, wonderful medicine which contains basically Loha Basma, right? Triphala and Jeshti Madhu, that is licorice, Glycyrrhiza glabra. Okay, so these are 5, and along with that, if you take honey and ghee, so it becomes 7 in number, and they are working together as a Amrit. So Sapta Amrit, so Saptamrut Loh. So when you take this Saptamrut Loh, I usually used to take, I don't know, should I mention the company on this platform, but it will be unethical, but one of the very commonly available company, not very different one. In Maharashtra, I used to take those particular 2 tablets along with honey and ghee. Again, in honey and ghee, we are again all aware that it should not be in a sama praman. It has to be in a vishama praman, right? So when you lick it with that, it helps a lot. Then other thing, when we think of refractive error, because some people, they mention Timira as refractive error. Some people, they mention Timira is something more serious. So when we speak about Timira as a refractive error, then I would like to give some common observations which we have gathered in couple of years, last almost 32 years. And in myopia, usually when you use Triphala or Triphala Gruta or Mahatriphala Gruta or Mahatrifal Gruta, then it is found out to be really more specific. Whereas in hypermetropic, that is positive numbers, you see along with this, you have to add a component of Yashti Gruta or Yashti Madhu Gruta. Okay. Now, I was also listening to earlier speakers, some portion whereby he was suggesting about different eye exercises. So I have had opportunity to learn at the periphery hospital of Nayar Hospital in Mumbai. There is one municipal eye hospital, Kamatipura, where I worked for around 3 years plus. And there is something known as orthotic exercises. So these are very specific. Now, when you do these particular orthotic exercises in that synaptophore, and then you give particular exercise to your different, muscles or extraorbicular muscles, may it be recti, may it be oblique, and then you see the changes in the act of accommodation, because the zonules which are holding lens in position, if we can work on zonules, then it will be really useful. Because if you see the pathophysiology from modern point of view also, then most of the time myopia is getting increased, particularly till a person is growing in height, because of axial myopia, because the orbital length gets widened, and because that is getting widened, the the image doesn't fall exactly on the retina, and all that part you all are aware of. So what we are doing, we are trying to work on the zonules or suspensory ligaments by virtue of doing this. Okay, but if it is done little wrong way, then let me warn you that it can also leads to squints. And I have come across some people, those who used to go to some naturopaths and some other places where they used to have this kind of eye exercises, not correctly, not scientific way. And then there was a fixation, and then they required to be treated with surgery. So actually, whenever we suggest this kind of regimen, then we need to stick to that particular scientific methodology to adopt with. Then coming down to Tarpan, many times people, they suggest that one should go Tarpan, Netra Basti, as we say in synonym. Some people use this plastic cups and plastic goggles, and then they put it, and then they put this ghee, which is liquefied ghee, and then they ask them to hold that particular ghee in that area and ask for patient to blink. But then I, in my practice, in my clinic, I usually restrict myself to using our ancient method, that is you use this udad, udad ka dal ka atta. Okay, and along with that, the little modification which we are undertaking in Maharashtra here is we are also using wheat flour. So you have a specific combination of wheat flour and udad flour, and then you make that dough, and then you make that circle around, and in that you have to insert or instill that liquefied ghee, whether it is Trifalagrita, whether it is Jivantyadi, whether it is Yashti Madhu or simple Gogruta, whichever way you wish for that particular patient. Okay, but then before doing that, I must mention here that we must know that whether my patient is really a right candidate to do Tarpan or not. I'm sure those who are actually working in ophthalmic department day in, day out, using modern technology also, they will agree with me that when you actually see a person having some pain or some redness, may it be ciliary congestion or may it be conjunctival congestion, so in then that case, it is required to actually examine that patient thoroughly, right? If there is a slightest infiltration, slightest injury to corneal bed, and if you're doing Tarpan, then it will create havoc. So we have to be very, very careful, not just because it has been mentioned in XYZ Grantha, and we should go ahead with that. So there has to have some kind of indications and contraindications. Okay, for example, in Adimantha for glaucoma, if a person is having angle closure glaucoma, then one has to think twice, thrice that should we really go ahead with Tarpan or not. So that particular thing I would wanted to emphasize at this particular platform. Then coming down to very difficult cases like your diabetic retinopathy or hypertensive retinopathy or something like retinitis pigmentosa, because I am working on RP and AMD, age-related macular degeneration, and all these, and even your optic atrophy cases and things like that. So we need to really assess the patient both ways, not just Ayurvedic way, but even modern way. And then we have to actually open up the cards to the patient and the patient's relative that, look, my dear, you are coming to me at this particular juncture where the prognosis is not really great. So I am going to help you out whether we can stabilize your condition at this particular moment. But you can't expect me to see to it that the vision, which is almost, moving body or perception light positive, PL plus in some of the quadrants, it can't go to 6.6. And if you suggest them this way, if you explain them this way, then patients are also happy. They are aware that you are not fooling them, you are helping them. and you also keep somebody in the pool, third person's evaluation, so that when that other ophthalmologist also examines at his own place and you are examining at your own place, then naturally, whether you are using your machine or he is using his machines, the result has to be uniform ultimately, isn't it? And then that confidence building up can be done not alone with the patient's mind, but with the modern counterparts. I have seen some of the modern vitreoretinal surgeons referring patients to us because they know that we are going methodically and we are opening our cards. Like, look, this is what is our area of working, and this is what I can do my level best. So I think with that, one or two more things I'll say, and then I'll end up because it's really getting late. I know. I am also using Jalokavacharan or Raktamokshan in some of the cases. I remember I have used leeches or Jaloka in cases of hyphema and hypopian ulcer. Okay, but that time I was in the hospital, so the backup was there. If something would have gone wrong, then there was a backup. Then I'm right now using a method of what we call Agni Karma with Suvarna Shalaka. Now, when we say Agni Karma, usually people, they understand Agni Karma with direct heat. You just keep the rod in any burner, heat it up, and then give. I am not doing that. Okay, we are doing Agni Karma with indirect heat, whereby you lit up that particular rod or heat up that particular shalaka from the other end, and the one end will touch up to specific point as mentioned by Sushruta Samhita, like Bru Madhye or Bru Puchante or Kaninake or Nasa Samipaste. Some of these are points. So you can do Agni Karma with that, or you can do Suchivet Karma. We call it as Vidya Karma. So with Agni Karma, we can work on various kinds of ophthalmic cases also. And rest all is already been discussed by my two learned colleagues. So I don't take my speech further. Actually, a patient is waiting inside Panchakarma room, so I have to even attend her. So with that, I take rest here. I thank you once again, Dr. Sharma sir and Dr. Agnihotri sir and Dr. Patinkar sir and the entire team. And I am really thankful to other two speakers because I could learn something new from them as well. Some new references. I was really astonished to know that, oh, palming is there mentioned in Gadanigra, which I was not aware up till now. So this is something really nice that we can come together and we can discuss, share our experience, clinical experience basically, and it will be helpful in future if you really wish to ask me to come for any other particular activity, because I was also involved into clinical research. I was also involved into ethical committees. Okay, I was worked in industry as a medical advisor and into KM Hospital as an Ayurvedic consultant in Ayurveda Research Center. So anytime, if anything, I can be of help to the organization, please let me know. I'm apart from MD, I have done my MS in psychotherapy, MA in yoga, and PhD in yoga. So with that, I rest here. Thank you very much.
Thank you, Dr. Phadke. Excellent.
Thank you, sir.
You have highlighted all practical issues regarding eye care. Very nice. Very nice.
Thank you, sir. Thank you, sir.
So
can I take leave if you don't mind? If
please, just remain, please. Dr. Ashish, please just remain.
Yeah. I'm there.
Thank you so much. Thank you, Dr. Pawan Sharma ji, for providing me this opportunity. Thank you, Dr. Ashish Phadke ji. It's a great pleasure to hear from you. And very interesting thing is that you have completed your post-graduation in Devgun. One of my very good friend, he did his post-graduation from BHU in Shalak. He is a professor, now retired professor, working in Patanjali, and he developed such a great interest in Devgun. He wrote a book, Devgun. So you both person became vice versa. At the same time, you became Achar Nimi for yourself. First of all, you made all efforts to remove your speckles. So this is one thing very important. And now you became the authority. So it will be a pleasure if I meet you in Mumbai. I am here in Pune, and I had been there in Mumbai also. I made some efforts to meet
So
with
please
Rajan
come, please
Patankarji.
come. You are most welcome. Kindly
Yeah.
call me up. Please come visit our clinic.
Definitely, and
we'll be very happy to meet you.
your presentation made such a great way out for Ayurvedic persons that nothing is impossible. You are expert. You have got a wisdom. You have got the text, so you can proceed to any extent, provided first of all you first made a confidence to your patients, which you have developed a lot. So thank you very much.
Thank you, sir. Thank
great
you, sir.
pleasure. Thank you.
Thank you, sir.
Now I would like to request Dr. Baragi. Dr. Baragi, Hari Om. Dr. Pramod C. Vargi.
Hari Om, sir. Hari Om, sir.
Hari Om, Hari Om. Thank you very much for supporting in this October month. Please support like this every month. This platform is yours. This platform is yours.
Okay, it's my pleasure to do the one. No, sir. All the three lectures were good by renowned persons and all those. Regularly in our college, we conduct all these camps and all those regarding the eye care and all those. Even for college students also, college students who are having specs and all those, we try to remove their specs by doing these exercises and also this tarpana and all those, Netra Dhavana by Triflakwat and all those. Regularly, we are conducting camps in our colleges, by which our students get confidence regarding this Shalakya, and also they get confidence to practice in future. So all our teamwork, including our principal, Sir Dr. Sanjay Kadlimatti, and our young and dynamic HOD, Dr. Gangadhar Timmapur, and his colleagues, are all working hard to bring all these new modalities so that it will be helpful for the department and also for Ayurveda to grow. These are few words which I can speak regarding this.
Thank you, doctor. Thank you very much.
Okay. Thank you, sir.
Dr. Manjusa Rajgopala was there, but I am not seeing here at present. So from audience, would you like to share anything practical regarding eye care? Welcome. Only focused on eye care with Ayush. If anybody has any practical experience, Dr. Mahesh Sharma ji is with us. Dr. Mahesh Sharma ji, welcome. Dr. C.P. Sharma ji is with us. Welcome, welcome. Dr. Mahesh Sharma ji, kahan gaye?
Yes, Dr. Saab.
नमस्कार, स्वागत।
नमस्कार डॉक्टर साहब, सुश्रुत में लिखा है अक्षी कुक्षी भवार होगा प्रतिश्चाय वर्णल ज्वरा पंचेते पंचरात्राणी प्रसाम्यंती न संशय। नेत्र रोग और उदर रोग, प्रतिश्चाय, व्रण और ज्वर, इनमें लंघन का विधान बताया गया है। ऐसा क्यों किया गया, किसी ने क्लियरिफाई नहीं किया अभी। नेत्र रोगों में लंघन का प्रावधान क्यों किया गया है?
बहुत अच्छा क्वेश्चन, बहुत अच्छा क्वेश्चन। मैं तीनों एक्सपर्ट्स में से कौन जवाब देना चाहेगा? डॉक्टर गंगाधर, डॉक्टर पुंडरीकाक्ष, डॉक्टर फड़के साहेब तो चले गए हैं शायद। If anybody would like to answer.
Yes, sir. I will give you some.
Yes, sure. Welcome. Welcome, Dr. Pundareekaksha. Your voice is not coming. Yes.
Yes, sir. 1 minute, sir.
I think Dr. Mahesh Sharma ji put the question in Hindi. If you are getting it's okay. If it is not that, his query is simply that as per the reference Akshi Gata Roga, why the Langan is 5 days is recommended. So have you got any base or argument on this issue? Please let us know. Thank you, sir.
Yes, sir. Yes, sir. Yeah, he told, actually Sushrita told that we have to do Langana for 5 days. Especially he told Pancharatra. Okay, it's not a full 5 days. Okay, is a Pancha Dinaratra is not mentioned. He told that Pancha Ratra means only the night time we have to do the Langanam. Okay, so and when we see there is a Aushadha Sevana in the Jatrurtagata Roga, we have to give medicine in the night time. Okay, Nishi is the main Aushadha Sevana Kala explained by the Sharangadara and other Acharyas also. So mainly in the Jatrurtagata Vikara. So in the Netra Roga also, in the Pratishaya also, we will give the medicine in the night time. So if you are giving all the food, after taking the food, if you give the medicine, because of that already food is there inside the stomach, this medicine may not absorb properly and reach to the eyes and or nose or Jatrurtagata places. So for that purpose, Sushruta told that we have to do at least 5 days for the Amapachana. Okay, Ama is the main cause for development of the diseases. Okay, so for Amapachana, if you do Langanam in the night time, Pancharatra Langana with the dosha, Amapachana can be happen. Later, we will take the food, no problem. But in this 5 days, almost all dosha patch happen, the severity of the disease will subside. So for the medicine absorption and for the dosha pachana, Sushruta may told Pancharatra Langanam. I think this is my view. Some more comments also expected from others.
If any expert would like to comment on this, Dr. Gangadhar. Hari Om. Am I audible to you, Dr. Gangadhar?
Yeah, sir. Yeah.
Yeah, please. Question is very important. Ampachana is also logically, absolutely logic. But please, we would like to listen your views also.
Yeah, actually, not only in eye diseases, in majority of diseases, we get references of Langana. Okay, Langana in this, as Sir told, Pundareekaksha Sir told, in some of the conditions, as we get a reference in Shushruta, mainly they tell during night time. During night time, they told to do Langana, but not during all around the day, that is for 24 hours. But we can take that also. And along with that, some of the again, as Sir told, so wait a minute, sir. Just I'm not getting this network.
Thank you, doctor. Thank you very much. Before starting to next question, I would like to share tomorrow's excellent webinar. Please do join, because tomorrow is unique day, World Singing Day. And by God's grace, right from Professor Arpan Bhatt, who is musician himself, Professor and Head, Department of Swasthya and Dean, Planning and Development, Jamnagar, Engineer Gaurav Tiwari ji, Pro Chancellor, Mansarovar Global University, and 12 singers from Ayurveda, 1 from allopathy, 9 from Ayurveda. All are seniors, expert in music, expert in singing, and I have requested them, all of them, that please communicate the benefits of singing in everybody's life, and please sing a song along with that. So 10 minutes will be given to all the expert of music along with Ayurveda and allopathy, and they will definitely inspire us. They will inspire next gen also, that we are not only discussing here these serious topics, but we are discussing really what government wants. Now we are discussing those points every day, everywhere. Ayurveda is every day, everywhere. Har din, har ghar, Ayurveda. In music also Ayurveda, in music therapy also Ayurveda, in singing also Ayurveda. Everything includes Ayurveda, or rather we can say Ayurveda includes everything. That will be the right word for that, right topic for that. So please do join tomorrow. Don't miss that tomorrow grand event. You will feel relaxed because every Ayurvedic or allopathic expert will be guiding us the benefit of singing, exercise, what we are eager to listen them. So please continue. Agnihotri sir, please continue.
Thank you, sir. Thank you, sir. Dr. Mahesh Sharma ji, I have a direct conversation with you whether you got and get satisfied on your question, because I got your expertise yesterday itself. So whether even the hidden concept is there in that shloka, Akshukukshi Gata Roga. Let me have, if you just revise the shloka.
यस, अपने 5 इंद्रियां हैं, पांचों इंद्रिय एक एक महाभूत से उत्पन्न हुई है। चक्षुर इंद्रिय अग्नि महाभूत से उत्पन्न हुई है। तो उसकी चिकित्सा शीत के कारण, शीत क्रिया से होती है, जैसे अपने अवगाहन करते हैं, परिचय करते हैं। और मंदाग्नि, कुक्षी रोग भी इसी से होता है, मंदाग्नि से ही होता है। ये अग्नि से जुड़ा हुआ कहीं कोई पार्ट होना चाहिए, मेरा ऐसा मानना है।
देखिए, इसमें प्रतिशय भी आ रहा है ना आगे चल के,
प्रतिशय भी मंदाग्नि जन्य होता है।
हाँ, तो इसीलिए तो मंदाग्नि यहाँ पर है, जहाँ पर श्लेष्ठ दोष की वृद्धि है, वहां पर लंघन इंडिकेटेड है। ऐसे करिए, अक्षी को रात्रि के लिए लंघन करवा लीजिए, कुक्ष के लिए भी यही कहा गया कि उसमें जो है विशेष रूप से रात्रि में प्रवर्धन रहे, रात्रि में उसको रेस्ट मिले, मतलब सीधे से इशारा है कि हम उसमें संभोग वगैरह न हो। और उसके बाद प्रतिशय जहाँ पर आ रहा है, वहां पर हम लोग लंघन को ले लें। तो हम रोगों को अलग अलग करके ये 5 रात्रि और 5 अहोरात्रि, इसकी अगर हम अवधारणा कर सके, हम एक श्लोक एक ही सांस में सबको न जोड़े, तो शायद एक बेटर वे आउट बीच में निकल पाएगा कि एक एक रोग को इनमें से ले लें इंद्रियों के हिसाब से। तो शायद बने, क्योंकि विद्वान हमेशा जो है खुले मन से अगर किसी भी श्लोक पर गहराई से पहुंचते हैं, तो और भी अच्छे से इस बात की, इसकी जो अंडरस्टैंडिंग वो निकल आती है। ये तो हुई आज के प्रश्न की बात। और मैं आज उन सभी विद्वजन से जो आज हमारी सेमिनार जुड़े, आज मेरी बड़ी खुशी है कि स्टार्टिंग से ही 28 से और 38 पहुंचे। आज हमें बहुत ही खुशी है कि हमारे जो गेस्ट स्पीकर,
कोई बोलना चाहेंगे
जी?
I would like to invite suggestion, speech on eye only, on eye care only. So
sorry to disturb, sir.
Right, welcome.
Yeah, as sir was telling about the Langana, even in animals also we can see that if the animals get sick and if they eat anything like grass and all, they're directly starting vomiting. So they also know that to have means to cure from that disease, they will be doing Langana, or they will not taking any food until they get cured by that disease. So just this I want to add. Okay?
Thank you, Dr. Gangadhar.
Sir, I have a question. कि
yes,
ये जो फड़के साहब ने बताया कि जलोका और अग्निकर्म किया जाता है उनके यहाँ पर, उसका थोड़ा सा प्रैक्टिकली अगर वो की स्लाइड्स वगैरह दिखाते तो हमें और भी अच्छा लगता।
हाँ, चिंता मत कीजिए, हम अगली बार उनसे
कहाँ किया जा रहा है, जलोका कर्म कौन सी जगह?
been very happy to show a demo, but believe me, it was the last moment, and I spoke extempore. Neither I have created script nor I have created slides, but some other time definitely I'll able to show the points and the actual work also. Yes, I can share the videos as well. But I can tell you there is a wonderful results with Agni Karma, and that specific method which has been taught to me by Dr. R.B. Gopte sir. Perhaps some of you must be knowing from Pune. He was head of the department of Shalya Tantra at Tiyak Ayurveda Mahavidyalaya. And he has developed one unique method whereby we are not giving direct heat. We are using indirect heat. So in a city like metro city like Mumbai, when people they are not that open, right? And there when we use something at here, I can show here. You can see me, right? Yes. So you can
Yes, sir.
apply at Bru. This is Bru, eyebrow. Bru Pucha.
Yes,
Pucha
sir.
means the end of the eyebrow. Then Bru Madhya. This is another point given by Sushruta. So Bru Madhya. And then Kaninaka, then Nasa Samipastha. This is another point.
Yes.
So these 3 points
Yes,
are basically mentioned for Timira, for Shushkakshi Paka, then many other conditions, many other indications they have mentioned. But I have moderately used in certain indications, not all, but certain indications. Even the same positions which have been mentioned in Agni Karma chapter, you can see the reference of those points in Sushruta in Vidya chapter or Raktamokshan chapter. In Raktamokshan, we have got various methods like Shunga, Labu, and also everybody is aware of, though nobody is actually doing in practice. But then we use scalp when we use Prachan also certain times. But Vidya means you are just putting that needle in and immediately removing. You're not keeping needle in. And in Vidya, what they have mentioned in that particular, chapter, or while teaching to us what sir told us, then I remember still that Vidya has to be done with a hollow needle. It can't be done with a pin, right? Because people they ask me, so is it same like your acupuncture point? So the answer is big no, because the basic pathophysiology and the basic principle of working with Ayurvedic aspect is when you actually pierce that and remove it, the obstruction in the circulation in that close by area gets cleared with this method. Then the Vayu, which is not Anulomit, which is Pratilomit, that Pratilom Vayu also comes out with this particular method. And that's how it works. That's what it has been mentioned in the Tika also, as well as sir used to say, and we follow that particular part. And then with this alone, you can see even before giving any medicines, you can see the changes. One of our another guru, Dr. Gala, who happens to be allopathic doctor actually, MBBS, but he learned it through his guru, who happens to be Rajvaid of Gujarat, some state of Gujarat, and he is using Ashtotana, Trifala Ashtotana in many cases, not only in eye cases but other cases also. So even in that, you can see we use Nasya. I am sorry, I've forgotten. One of the major modality in working with eye problem is again Nasya. I have treated cases of amblyopia which were thrown by allopaths. After particular years, they said nothing can be done. You do patching, and you do other stimulation and things like that. With vision almost 660 or less than 660, and that could regain to something like 612 or 69. RP cases 66, 69, which was actually thrown away cases. So you can have NASA through NASA, that is Nasya. Nasya, again, you have to actually decide what kind of Nasya to be given when, whether the patient is in a Samavastha or Niramastha. Very apt discussion was going on that whether to be given Langan or what kind of Langan. Langan has to be abalavirodhenatu. So Langan should not be crossing a limit so that the Vata Prakop will again recur. So you have to give Langan considering that it has to be Bala Avirodhena. And then you can
Langanam Lagu Bhojanam.
Other things. But yes, you are very right. I should have used. I'm saying sorry on my behalf. But yes, that can be done. Yes, very true.
Okay, sir. And sir, जलोकावचारण के लिए भी यही points रहेंगे. जलोकावचारण, leech therapy.
Jalokavacharan, again, I have used in certain conditions, not in all. As I said, hyphema and in hypopion ulcer, which was risky. I'll not suggest to use it alone when you are working in the clinics. Because if you have got backup and OT and other procedures, then it's fine. But on the outside, Apanga you can use, at Shankha you can use. At these points also you can use Jaloka, and it actually catches and it gives result. The points are same. Points are not going to change because those are the points which has been mentioned by Acharya Sushruta. And we are nobody to add anything to that. So we have to be with that, understand it in current scenario, in current era, how we can utilize it with the best of our both knowledge from ophthalmology, knowledge from Ayurvedic Shalakya. And with that we can use. But the points are same. I'm not going anything away from that. One more is Shankha. Shankha Pradesh, I'm sure everyone is aware of. So here, here. But when you use Jaloka or Charan, it sometimes creeps. So we have to be careful that it should not get inside the
Yes, sir. Yes, sir.
eye, because that will be
Yes.
problematic. Basically, patients are not
Be carefully.
willing to use Jaloka, frankly speaking. If you want to use Jaloka, then you ask that person to keep eye closed and keep pad, cotton pad, and
Cotton or
then
gauze.
that is okay.
Yes, yes.
But
yes.
take the permission. And now, what is actually important, since this is ethical committee, independent ethical research committee. So I would strongly suggest that all of us, we should come together on some different platform, some different day, and create forms, consent forms. Like when we go to any allopathic hospital, they just push number of forms to us and say, kindly sign, and then only they will accept patient to get admitted. But here in Ayurvedic clinics, whether it is Panchakarma clinic or simple clinic, we don't usually do that. Even when I'm saying, I was teaching to students, then also I used to say, but very honestly, even now I have not started doing it, but we should do, because the things are changing. Suppose tomorrow someone takes you to court, right? And then if you don't have this kind of consent form, then there'll be problem. When you're undertaking any particular case for any trial, for example, I see somebody is from some CRO. So they are knowing that unless and until you don't have informed written consent, you should not, entertain any particular candidate to be a member of that particular trial. So likewise, even in clinics also, we should have a consent form made particularly for particular procedure. And we should explain the possible benefits and possible hazards openly in their local language and English and Hindi if required. And then you should ask that person to sign. If that person is not adult more than 18 years, then his relative has to actually sign on his behalf. And it has to be signed in a SNDT format. SNDT format is signature, then name, then date and time when he is signing. So when you do this SNDT format, then it is accepted all over globe. Whether I am going to Europe or US or any other countries, they are going to accept, because this is what is the standard protocol. And when we do that, then I think we are doing some fair job. I hope I am spoke enough on this particular aspect.
Okay, sir.
Namaste, sir. This is Dr. Naveen from Bangalore, Sri Ayurveda College, Department of Shalakya, sir. So I would just want to second you about this, sir. We have been doing with the karma. I hope I am audible, sir.
Yeah. Clear, for me, there is little problem. So I'm taking my phone to my ears. Kindly excuse for that. I'm listening, but.
So I would just
thanks for that.
Yeah, I would just want to second you, telling that I've been practicing with the karma for all Shalakya disorders. Since we are speaking only about the eye, we have been recording with the karma before and after, just after checking the IOP. So with the karma, we have been seeing that there is at least two digits of fall we have already been noting in all patients. So NCT from the same machine before patient comes with headache, if it is unilateral, bilateral, whatever it is, be it glaucoma or be it normal tension headache. So we see that there is a fall in the IOP. That itself is a major evidence which
yes. Even I do observe that. Yes, I agree with you. And we have to actually come together and write articles. I don't mind getting collaborated with you, and we can write articles explaining possible mechanism of action. Because
exactly, sir. Even for tinnitus, because today it is eye. Today it is being eye that is discussed. So that is why even in tinnitus we have a wonderful result. Shankha Pradesha 1 with the karma, we have an immediate on the chair response for tinnitus.
Very good.
Thank you for the opportunity.
This is really interesting. I would like to have your email and number, sir. If you can communicate to me, my number is 98926 98275.
Please
my website is ayurvision.org.
Chat box, Dr. Naveen.
Yeah, I'll write down.
Sir. Sure,
and Professor Madan Sharma, Professor Pawan Sharma ji, we are fortunate enough to have Dr. Shantala Pidarshini with us. So it will be our pleasure to invite her
Right,
so
right.
that we
Very
will
right,
be
sir.
united.
Great.
Dr. Shantalaji. My Dr. Naveen. Am I audible? Dr. Naveen? No.
Yes, sir. I'm there, sir. I'm just driving my car, so I will
Okay,
just get back to you, sir.
No
Sir,
problem.
I think Shantala madam is not there. Shantala madam has left, I think so, sir.
Oh, in your college, my daughter is studying Sri Ayurveda College.
Oh, nice to hear that, sir. Thank you, sir.
Thank you very much. Shantala ji nahi hai?
Sir, excuse me.
Huh?
Yeah, sir. Myself, Dr. Gangadhar. I want to share this week's patient experience. Actually, I got a patient of blepharospasm last week, and we have started treating him with Nasya. As Ashish Patke sir told, Nasya is also having an effect on some of the eye diseases. So I have started Mukha Abhyanga with some of the Kshirabala, Mahanarayana and Prasaranyadi Taila all mixed together, and Mukhabhyanga is done. Along with that, I am putting this Karpasastadi Taila for in each nostril 6 drops, and Seka also, Seka with plain Trifla Kashaya. So this was done for 3 days, and from 4th day I have started Tarpana with again Triflagrata, and Pindi has been done with a paste made up of Dashamula paste. And so today when I met that patient, he told about 70% he was feeling comfortable. And when the patient came to my OPD, he can't able to open his eyes in that dim light or in a room light. So when I saw him today, and he was sitting outside our hospital, just taking the sunlight, and he was opening his eyes totally. He can't. There is no any photophobia and no any symptoms of blepharospasm and all. So he's totally happy. And along with that, I have given him a Rumalaya Fort, 1 TID. So with all this, so mainly I want to conclude this with Nasya. He might have get that much positive signs.
Yes, I agree. Nasya gives immediate result in most of the Urdhva Jatrugata Vikara. So yes, Nasya has got main role. Other thing I just wanted to share with, if there is a permission of chair, that sometimes blepharospasm is also presented with Manas Bhav. Some kind of psychogenic problem is there, and whatever you try with Vatagna treatment and Nasya and whatnot, it doesn't work. And that time you require to recheck the entire history, dig into proper history taking, and then if you see that there is a Manas Bhav, you have to work on Manas Bhav also.
Yes,
so
sure.
that just I wanted, because in one case I could not get any result. With all these, whatever sir has mentioned, even I use all those things, even Agni Karma also I use, but no result. And then suddenly I remember, realized that, oh, I am missing on this. And when I started working on the Manas Bhav Chikitsa, may it be Dravya Chikitsa or Adravya Chikitsa, and that's how I've learned all the psychotherapy and hypnotherapy and Reiki and chakra therapy and whatnot. Even I am into music. I'm a vocalist. I am diploma in music from Bombay University. And I use music therapy as well, sometimes. So when you use such kind of thing together as a holistic approach, then you see the immediate result. But we sometimes miss on that. So just I wanted to, emphasize that point. But it was very nice knowing that it is really working. And blepharospasm is really difficult because they have already been to neurophysician, then opthal and whatnot. And by our simple Nasya and other things, if it is giving result, then patients, they built up great confidence on Ayurveda and Ayurvedic consultants. Thank you very much.
So you please join on tomorrow also, Dr. Ashish ji.
I'm not very sure, sir, because tomorrow I'll see if I can join, but I'm not very sure. Just kindly send link. I'll see if I can. I know Dr. Arpan, but he's a very close friend of mine. We were together for yoga for many times.
Yeah,
but
we will like
I'll see. I'll see.
We like to hear something in music by you, sir.
Yeah. Sure. Madam is speaking. I'm waiting for her. Shantala ma'am is coming.
No, she has left.
Oh, is it? Okay.
जगदीश, आदरणीय जगदीश जी, आप आंखों के बारे में कुछ बोलना चाहते थे। आदरणीय जगदीश्वर डोमा जी।
दादाजी नमस्कार। सभी लोगों को मेरा विनम्र प्रणाम। सभी लोगों को। एक्चुअली अभी सुनते सुनते फाड़के जी थे तो इतना अपन कंग्रेचुलेट करना है कि मॉडर्न मेडिसिन से कि कितना इन्वेंशन एंड presentation was there in Ayurveda, and Pawan, this platform is using for the generations and generations. I say that we are very earlier to the development and the researchers of today's, which has become popular. In that perspective, a little bit, I want to personal presentation that I have been prescribed lenses for my short sight by 51 completion itself, though now I am 71 completed. And that was of short sight. For regular checkup, once in 2 years, I was approaching a laser hospital at Warangal and getting examined. And the doctor, ophthalmologist, he was telling that, sir, your problem is not at all changed. The same is in continuation. And we are not going to change your lens, glasses also, and the point and all those things. But you continue the same thing. For that also, I was little bit hesitating to wear the glasses. And now I practiced in such a way, actually, in yoga, those who perform Sarvangasana, they will get cleared of many diseases related to head. That means many are located in head only, Gnanendriyas. And likely, my Gurudeva, Anandamurti ji, has forbidden to perform Shirshasana. Because for every performance of yoga, one should observe the running of the breath, Chandra Nadi, Surya Nadi. Only in Chandra Nadi, these performances should be done. But in the Surya Nadi, it is done, it will become little bit adverse effect on the body. This who had the depth of teaching or understanding will practice. And likely, Sarvangasana, if it is followed regularly, followed by Matsya Mudra, then they will have proper maintenance of the Indriyas, Pranendriyas located in the head portion. And in that line, I am the practitioner right from 1972 till 2012, when I have undergone operation to the right leg where the tumor gone up. Thereafter, I am unable to perform Matsya Mudra. That is why the Sarvangasana is also left up. And in this line, we should remember that all whichever may be taught in Ayurveda, first, free from medicine, observation and lifestyle and what and asanas and all these things, they are being taught in yoga system by Sadashiva. That is why he was the first Yogeshwara. If the Yogeshwara is being attributed, first Yogeshwara is Sadashiva. And the second Yogeshwara was Sri Krishna. And like that, why these people are called Yogeshwara and Mahakaul, whosoever practice Kundalini sadhana, and yoga, they are all called Kaulas. And these people are Mahakaulas. Characteristically, there is a difference. Whom should we call Mahakaulas?
Sir, focused on eye care only, sir.
Okay. The same thing. Coming to
only focused on eye care, please.
Okay. The same thing. In that line, yoga asanas, I just referred about Sarvangasana. And for medicinal things, I do not know because I joined lately after 1 hour, 7:47, I joined, were referred or not. If anybody takes regularly at bedtime 1 spoon of Triphala churn added with unequal proportions of ghee, that means clarified butter, and honey, they will have proper vision for the lifetime, indifferently to the ages. Likely, and Saptamruta Loha also, it is very, very, that is primary, taken into granted medicine for service of eye troubles. With this, I conclude.
Thank you, sir. Thank you very much.
एंड पवन जी, यहाँ पर लंघन के बारे में जो बोल रहे थे, लंघन के बारे में, एक्चुअली लंघन के बारे में रात के समय पर जो लंघन के बारे में बोल रहे थे, तो वहां पर दो चीज का ऑब्जर्वेंस, अगर अपन आयुर्वेदिक साइड से देखें और अदर साइड से देखें कि रातों में खाते दिन में नहीं खाते, तो वो लोगों का क्या हाल होगा जब वो ऑब्जर्वेंस रहता है. व्हाट स्पेशलिटी वुड हैव दे if they take only diet in the nights and quip off in the day hours. That is why actually the healthy system of practice is that taking less food in after sunset. Thank you very much.
Thank you. Thank you. Now I would like to request Professor V.K. Agnihotri, sir. I hope question and answer session was satisfactory. We will be meeting day by day to celebrate every day. Day after tomorrow, food day is there, where on Ayurvedic food we will be discussing some Ayurvedic recipe with Ayurvedic expert and cuisine expert also. Thank you. Thank you. So, Agnihotri, sir.
Thank you, sir. Namaskar, Dr. Pawan Sharma ji. It's a pleasure that we are reaching to our closing point, and the second pleasure is this: we are extending our thanks when we are in 22 number in strength. So that's why the persons are there to whom I extend my thanks for their availability, for their joining in today's webinar. And the final remarks are concerned, really it was a full of knowledge session where all the guest speakers, they poured their knowledge. They were really a distinguished one, especially Ashish sir, who was having a post-graduation degree in Devagund. So he is a master enough to see that what are the herbs used in Chakshush category and are much more useful, especially the Harar, Bahera and Amla. So this masterly hold knowledge is ultimately made a wonderful concept for them to become an eye surgeon, and with all the available facilities like Achar Shushut and reference with the Nimitant, that where the Agnikarm is indicated, where the Jalakav Charan is indicated, and the rest of the time Tarpan, Nas, etc., etc. And meanwhile, Dr. Naveen also participated and seconded all these things. Of course, it is very good that eyes are very, very important organ of our body, and as long they are working, it's our fortune, it's our luck. And for their maintenance, lot of things are there, right from the spectacles and all that, but especially spectacles in comparison to that one, the first class observance of Dincharya, because that Dincharya, Ratcharya, Ritucharya, Sandhyacharya, these all along with the naturopathy and yogic practices, they all giving fullest form of the health and hygiene for a healthy person. And again, if it is get affected, the so many ways and means are also there in the form of the medication be used for the management of the eye disorders. So all the distinguished guests made all efforts to give knowledge, and we are all benefited. Pleasant is this that rarest of the rare questions were there, and ultimately they were also answered very intelligently. So I extend my all good thanks to our all the guest speakers along with the distinguished, because we have got a very good number. It was 38 number. Again, I thank Dr. Rajan Patankarji for the making such great guys available to a platform as a guest speaker. So those who are behind our curtain, those who are supporting us, those who are always with us, for them, Har Din Ayurved, Har Ghar Ayurved, Har Saans Ayurved, and everywhere knowledge should be important. Knowledge is being extended by our guest speakers. So thank you very much. Thank you all.
अग्निहोत्री जी, आपका लिंक डेली मिल सकता है क्या?
बिल्कुल मिलेगा, बिल्कुल। आप अपना फोन नंबर, व्हाट्सएप नंबर डाल दीजिए, डेली मिलेगा।
कहाँ डालना पड़ेगा?
यही चैट बॉक्स में डाल दीजिए। डॉक्टर पवन जी को
आप मेरा हेलो जिन को इंटरेस्ट है, जिन को
मुझे भी
इंटरेस्ट
लिंक
है,
आप भेज दीजिएगा। थैंक यू, धन्यवाद।
एक मिनट सुनिए ना, 1 मिनट सुन जाइए। जिनको इंटरेस्ट है काइंडली मेरा नंबर नोट कर लीजिए, 983091
एक सेकंड होल्ड रखो सर
जी,
98309309
89242।
ठीक है सर,
बस इस पे आप डाल दीजिए, मैं आपको ब्रॉडकास्ट लिस्ट में ले लूंगा। हम लोग रोज मिलते रहेंगे। आप कहाँ से हैं महेश शर्मा जी?
मैं राजस्थान, जयपुर।
बहुत अच्छा, बहुत अच्छा, धन्यवाद।
अच्छा पवन जी, वो राकेश जोशी से बात नहीं हो पाई कल के लिए? डॉक्टर राकेश जोशी जी की बात नहीं हो पाई?
नहीं हुई?
सिंगर है, उनसे हमने ही इज ऑलमोस्ट रेडी।
देहरादून ना?
हाँ देहरादून।
अरे तो आप कहें ना हो
मैंने
पाए ऐसे तो हालात नहीं।
आपने बैनर दिखाया ना, उसमें देखा उनका नहीं है। दिनेश विश्वास का तो है, वो भी अपने ग्रेजुएट है।
एक मिनट, तो फिर राकेश जोशी ने ना की होगी।
अच्छा, वो तो उनसे मेरी वार्ता हुई थी और उन्होंने कहा कि क्या करना है, तो बहुत अच्छा हुआ है।
हेलो,
मैं अभी
हेलो पवन सर जी।
राकेश जोशी का है ना? हाँ जी, बोलिए ना।
हेलो पवन सर जी।
जी।
सर मेरा एक रिक्वेस्ट है, अभी जो हम रेगुलरली जो ज्वाइन हो रहे हैं 25 से 30 लोग, उनका एक आप व्हाट्सएप ग्रुप बना लीजिए, तो आपको मैसेज भेजने में आसान रहेगा। लिंक एकदम सबको चला जाएगा और हम सबको भेज देंगे सर। वो
ये अच्छा सजेशन है।
एक ग्रुप बना दीजिए सर, तो इजी रहेगा। हम सब ऐड करके रहेंगे उसके अंदर।
आप एक बार मुझे भेज दीजिए अपने नंबर में।
देखिए बना हुआ सब है, हम लोग थोड़ा हैकर से थोड़ा परेशान रहते हैं। हैकर से हमारी बनी बनाई शाख खराब हो रही थी, तो इसलिए हम थोड़ा फिल्टर करके ज्वाइन कराते हैं।
और राकेश जोशी जी हैं साहब, सेकंड स्लाइड में राकेश जोशी जी हैं।
अच्छा, बढ़िया, मैं उनका नाम नहीं देख पाया था। ठीक
है।
आप सब लोग इतने इंटरेस्टेड हैं, आप लोग बराबर बने रहिए। आपको लिंक बराबर डेली पर्सनल बेसिस से पहुंच जाएगा। बस अपने डिटेल्स आप दे दिए और प्रोफेसर पवन शर्मा जी से आप संपर्क रखिएगा, तो आपसे हम और हमसे आप जुड़े रहेंगे।
थैंक यू,
धन्यवाद।
सबको नमस्कार, प्रणाम, गुड नाइट।
अग्निहोत्री जी।
जी सर।
कल जो है ना महेश शर्मा जी का सुंदर प्रेजेंटेशन था। I became very pleasant of his presentation।
जी
महेश शर्मा जी का
जी
आयुर्वेदिक तरफ से,
और उनका डिस्कशन बड़ा अच्छा हो गया जी। उनका डिस्कशन बहुत बढ़िया हो गया था। हमें खुशी इस बात की हुई कि वो आए, कल ही जुड़े और अच्छे से। ये राजस्थान की परंपरा है, हम तो यही कहेंगे राजस्थान की परंपरा गहरी है। और उन्होंने उनका और हमारे कल थे अपने शर्मा जी, जब उन्होंने उनका जो चरक पर चर्चा कराई विशेष रूप से, तब उन्होंने इस पर जो डिस्कशन आया, वो चरक के गहरे से गहरे भाव सामने आए। मेरे पास पुस्तक है और उन्होंने जो शिरागत बात विशेष इसमें थ्रोम्बोसिस के मामले में, थ्रोम्बोसिस की जो गाइडलाइंस पर जो चर्चा हुई थी वो बहुत सुंदर, श्याम सुंदर जी के साथ में।
बहुत बहुत अच्छा था,
अच्छा
बहुत अच्छा था महेश शर्मा जी का।
नहीं तो हम तो डर ही रहते कि थ्रोम्बोसिस में आयुर्वेद को कैसे उसको टाई अप करेंगे, लेकिन शिपी शर्मा साहब ने भी बात रखी कि वात और कफ का जो है वो विशेषण है, और वही चीज उन्होंने शास्त्रोक्त भी बतला दी। बहुत अच्छा रहा, आपने सुना, आपने आज प्रशंसा की तो और भी अच्छा लगा कि यही हमारी वेबिनार के आयोजन करने का जो कहना चाहिए परिणाम भाव है। तो परिणाम भाव अच्छा होगा तो
वहां पर संस्कृत शब्द जो संस्पर्श या संस्कृत कुछ रेफर किए, that carries lot of depth of the meaning actually। वहां पर जो वात और कफ का संस्पर्श या संस्कृत कुछ रेफरेंस,
रस रक्त संधरण उनका उपयोग किया था।
that not that वात और कफ का संस्पर्श या संस्करण कुछ
वैद्य सोमेंद्र मिश्रा जी का जो वक्तव्य था,
that carries lot of depth of the meaning। I don't think that there is any synonym in English literature। That please just go ahead, because I'm not remembering. Yesterday only I wanted to comment, but at the same time I missed the chance to comment। that word cannot be translated।
पित्तानुबंधी वात की बात उन्होंने रखी थी, और
वात और कफ का
नाड़ी तत्व दर्शन का उन्होंने रेफरेंस भी दिया था। नाड़ी तत्व दर्शन के तहत
नहीं, अग्निहोत्री जी वहाँ एक ही वर्ड था, वो वर्ड संस्कर्ष या संस्पर्श ऐसा कुछ था वात और कफ का।
डॉक्टर महेश शर्मा जी आप बताएंगे? मैं नोट तो करता हूँ,
शायद शर्मा जी खुद बोले थे।
अच्छा आप भी बोले थे?
हाँ, शर्मा जी शायद बोले थे, या सोमेन जी बोले थे। आप जो है ना
सोमेन मिश्रा जी बोले थे, सोमेंद्र मिश्रा जी बोले थे।
हाँ, जरा एक बार देखिए वो शब्द का।
श्रोतो दृष्टि वात का कफ के साथ में संयोग, संघर्ष, क्या संघातक प्रवृत्ति, ऐसे कुछ कहा कफ और श्लेष्मा कफ, ये तो शिपी शर्मा साहब का था। और
संस्कर्ष या संस्पर्श ऐसा कुछ बोल रहे थे वात और कफ का।
रक्त मार्म नियंती आशुशंक
अति प्रवृत्ति संगोवा चराणम ग्रंथियों, ये बोला होगा। अति प्रवृत्ति संग श्रोतो दृष्टि, अति प्रवृत्ति संगात्मक श्रोतो दृष्टि होती है।
संगात्मक मतलब कुछ है शब्द,
नॉट संगात्मक। If you just revive and hear that lecture, immediately we can come to the word that I don't think that there will be synonym in English।
आ जाएगा उसमें आ जाएगा, एक बार दोबारा सुन लेंगे।
देख लिया था। हाँ, मिल जाएगा। मैं देखूंगा यूट्यूब में मैं सर्च करके वो वर्ड फिर से डिस्कस करूंगा। I don't think that
कभी उसके दर्शन हो गए जी।
What we are recollecting।
Thank you Momita Sharma ji, thank you Dr. Parikshit Devnath, thank you very much for supporting Dr. Parikshit, Dr. Momita ji। हरिओम, गुड नाइट सर।
गुड नाइट, नमस्कार, प्रणाम।
सभी को नमस्कार, कल जरूर मिलना है।